watching them overcome their fears, and they come in, I hate needles, I can't do this, or watching them just get through it and push through it, and they're changing their lives and I'm changing their lives as well. I would say I'm going on about 2.5 years with CALRegional as an instructor. Lots of classes. I teach the morning and evening. So I was a medical assistant. I took my program, I would say about 14 years ago. From there, I've worked at urgent cares, primary care clinics. My last position before becoming an instructor, I was a office manager up in Rockland. I was there for about 8 years and then, decided to start a family and then proceed to go into instructing. My students are getting hired like right out of class. A lot of them are getting hired on at externship. They're getting hired on at Sutter, UC Davis, Dignity. Like the past students you just interviewed, one's with Marshall Medical. So I think the job outlook is very promising for medical assisting because we're not just utilized in one office. We can be in insurance, we could be in the clinic, long-term care. We're utilized a lot more now, I would say, because they're giving us more opportunity, especially with the new certification with clinical aspect of it. I would say the job outlook is very promising for medical assisting. Coming from an office manager's perspective as well, having to train externs as they come in, we're teaching them the fundamentals. We're teaching them proper technique, how to get those injections across, how to run those urinalysis, complete those ear lavages. I think we set them up for success as long as they're taking the initiative to, really hold on to those fundamentals and proper technique. We have 20 mods. Depending on whether it's the evening or morning, they could roughly be 8 to 10 week programs. And in that 8 to 10 week program, we're going through those 20 mods. And each mod is, whether it's a body system or it could be legal issues, we're gonna go over, we have a mod day and then we have a skills day because it's a hybrid program. So we're online, in person, online, in person. So when we go over that curriculum, the next day we're gonna follow up with skills that pertain to whether it's the muscular and skeletal system. We'll learn how to fit a patient for crutches, cane, walker, 8-figure wrap. If we're working with infection control, we're running strep tests, going over sanitization, disinfection, sterilization, autoclaving. So your skills day will correlate with your material that you're learning. If I'm ever talking about the program, I like to start off with that it's a fast-paced program. You're diving in head first. You have to know what you're gonna expect. You have to give yourself a little bit of grace. To have patience with yourself. You're learning new skills, you're overcoming fears and challenges, but just being patient with yourself and giving yourself that little bit of grace period to just get accommodated and adjusted to the program. You're gonna end up loving it and you're gonna be sad the day it ends. And most of the students are like, I don't know, I'm gonna miss this, like what am I gonna do? You're gonna go get a job. CALRegional does a great job of supporting their students. We want you in that chair. We want to see you succeed and grow and pass the course. So it's just having patience with yourself and knowing that what you're getting yourself into, but it's not hard if you just apply yourself.